Hi everybody, so this week we're going to talk to you about hay fever. So first of all I want to talk about what hay fever actually is. So it's an allergy to pollen and it affects 1 in 4 of us, and it can be really harsh on people in the summertime to have horrible symptoms that prevent them from wanting to go outside. So it will be like an itchy runny nose, you can have a blocked nose, your eyes may be itchy, you could have a scratchy throat or a cough. And on that point of having a cough, I'm going to put up a slide later on which shows the differences between COVID-19 symptoms and hay fever. There are certain things you can do for yourself to help limit your symptoms. So those would be like closing the windows at home, not letting the air in, which could bring pollen into your household. Hanging clothes out in the line on sunny days can actually catch pollen on the clothes, so if there's someone in your house that is a hay fever sufferer, it may be best not to do that. Wearing complete wraparound sunglasses, which would come to the side of your head here, it prevents the pollen from affecting your eyes if your eyes are one of the areas that are really affected for you. You could also vacuum regularly in your household, which will remove pollen. And you can also maybe put a wee bit of Vaseline around your nose. It can help some of the pollen being breathed up into your nasal passages. So things not to do would be to go out and cut the grass if you're really suffering, or to have fresh flowers in your house, as these are ways that you're bringing pollen into the household. Leaving the windows open as well can also bring pollen in. And the thing is, you want to limit the amount of pollen that comes in. The first line treatment then for hay fever over the counter is the steroid nasal spray. So this is just an example of one that we have in store. So you can use this once a day, one spray in each nostril, and you can actually start this maybe a few weeks before the hay fever season starts. This may help you from having to double up on the dose if you're having a really bad reaction to the pollen. The next thing you can take then is eye drops. So these are a wee form of eye drops that we have. This will help you with the symptoms of itching. And when you rub the eyes, it can actually irritate the eye itself, which makes things worse. We also have the tablet form of medication. So we have cetirizine, which is a once a day tablet, and that can be taken by anybody over the age of 6. We have loratadine, which is a once a day tablet as well. I'm holding that upside down. Once a day tablet. And we have Piriton. So Piriton is considered to be one of the more drowsy ones. Some people are affected by drowsiness from hay fever medication and others aren't. So this one here can be taken 3 to 4 times a day. And we also have acrovastine, which can be taken up to 3 times a day as well. So there is a range of medication. I would normally recommend people start with cetirizine and see how they go, because it's considered to be one of the non-drowsy antihistamines. We also have a range of things for children. So we have the Piriton, which is suitable from 1 year and over. This obviously can cause drowsiness too, so it's something to be aware of when using it with young children. Then we have the loratadine and cetirizine again. These are suitable from over the age of 2. And then we have the hay band, which is really popular, and it's a non-drug method of treating hay fever, so to speak. It works by stimulating certain pressure points. So I've actually put one on to demonstrate to you. So the point here needs to be in the crease of your arm in order for it to work. So you just pull it up and adjust it so that it's comfortable, and you wear this here, and this is meant to stimulate this pressure point and relieve your symptoms. We also have a private service. It's known as a patient group directive, a PGD. So this allows us to prescribe prescription only medication in certain circumstances. So if none of these over-the-counter treatments work for you and don't help your hay fever, book an appointment to come and see us. We have stronger steroid nasal sprays, which are suitable from over the age of 12, and we have fexofenadine, which is a stronger antihistamine, which can be prescribed under certain circumstances as well. Those require a consultation with the pharmacist, and then after that consultation, if it's deemed appropriate, we will prescribe that to you. You can access this information on our website as well. We have a section, if you go to book a consultation, and there's a section there where you can book a hay fever consultation. This can be done via video link, or you can come into the pharmacy and do it face to face with us. So it's whatever suits yourself. If there's anything that you need, like always, any advice you want on hay fever, don't hesitate to give us a ring here at the pharmacy. That's what we're here for. Okay, thanks very much.